and welcome to the program. I'm Layo Adegoke. We begin this week with stories and happenings that made headlines over the weekend.
At least 6 people were killed on Sunday when a minibus was hit by the blast from a roadside bomb near the Somali capital, Mogadishu. Police say the vehicle's passengers, mostly from the same extended family, were traveling from the city to a funeral in a nearby town when it hit the explosive at Hawa Abdi village, 19 kilometers northwest of Mogadishu.
The driver is my brother, Mohammed Mahmoud, and he had been working on this road so many years. He's a minibus driver and works between Mogadishu and Wanlawein town. He drove from 6:30 in the morning from ex-Control Abgoye and on the way to Wanlawein town. A roadside bomb exploded and killed all the people in the minibus. We pray Allah to give his forgiveness.
There was no immediate claim of responsibility for the attack from any group, but since 2008, the Islamist militant group Al-Shabaab had been fighting to overthrow Somalia's central government and establish its own rule based on Sharia law. On Saturday, a boat carrying 101 migrants was intercepted before attempting a journey to Europe from the Libyan coastal city of Garabouli. The Interior Ministry says the migrants, which included women and children, were taken to a security checkpoint in the city of Homs, 120 kilometers east of the capital Tripoli. The Ministry of Tripoli's Government of National Accord that made the interception in the early hours of Saturday morning said the migrants would later be transported by bus to a detention center. Since the fall of Muammar Gaddafi's regime in 2011, Libya's western coast has become a main departure point for migrants bound to Europe fleeing war and poverty. Many are still attempting the crossing despite the closure of Libya's international borders because of the coronavirus.
We begin our coronavirus coverage with the top figures from Africa. The continent has now recorded 147,248 cases. From that figure, 80,740 are the active confirmed cases. More than 62,000 people have recovered, and the death toll stands at over 4,224. South Africa still has the highest number of cases on the continent with 32,683. It's followed by Egypt with 24,985 cases and Nigeria reaching the third on the list of countries with the highest number of infections on the continent with 10,162 cases. Algeria is fourth with 9,394 cases, followed by Ghana, which has seen 8,070 cases. Meanwhile, the countries with the most fatalities are Egypt with 959, South Africa 683, Algeria 653, Nigeria 287, and Sudan 286. Well, South Africa is delaying the reopening of schools by a week to allow school administrators time to prepare. Final year students in primary and secondary schools are now expected to report back to school on the 8th of June. South Africa has also begun level 3 of the easing of lockdown restrictions with the sale of alcohol and movement within districts allowed.
Today marks the beginning of level 3 lockdown restrictions in South Africa, which means many more businesses are allowed to open, but there are those still not allowed.
You know, I used to do a lot of things. I was an events coordinator, but now we're out of job, Corona.
I can't wait to get back to normal. I'm ready for lockdown to come to an end now. I'm enough.
The celebrations are not part of a religious or sports gathering. The queues are for alcohol. The ban on alcohol sale has been lifted and people are very excited.
Everybody's happy, everybody's excited. So I'm going to buy 6 beers and I'm going home.
Yeah, no, I'm just here to buy my alcohol and then I'm just feeling so happy. As you can see, like, so happy. I wish the situation can just stay like this, you know.
So I'm standing in the queue for my husband for beer. He's at work. He went back in level 4. I'm a tea drinker.
The big thing here is we would have liked to open up earlier. I think the customers would have liked us to open up earlier as well. But we're extremely happy that the government's actually allowed us to open with these times. With the first initial outlay, there was the discussion that we were only going to be open until 12, Monday to Wednesday. So we are extremely happy the government has allowed us to open until 5. As this, number one, not only allows us to maintain social distancing and protocols, but it also allows the customers more range of time in which to shop.
The expected opening of schools for grades 7 and 12 pupils did not happen any longer after a late-night announcement by the Department for Basic Education. This is over concerns by different interested parties about the arrangements for personal protective equipment as well as water and sanitation arrangements. Schools are now expected to reopen on the 8th of June. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Oh, Betty joins us now for more on this story. Hello, Betty. Thank you for speaking to us.
Thank you, Laya.
And I see there's so much excitement in the air, especially because of, South Africans being able to buy alcohol now. But what more liberty exactly do citizens have, under this level 3 lockdown?
Well, the airlines will be able to fly now for work only, for business only, which includes work, like the media can travel by air. Although no flight, I don't think any flights happened today, but there are preparations in place going. Some have actually said we'll be able to start flying by middle of the month. Also, interprovincial travel by road can happen when you prove that what you're going for is essential, especially work as well. Apart from the schools, more businesses, except those that bring people very close, like the salons, the spas, and places like that, are still not allowed. Hotels are not allowed, but we got mixed messages from the minister when they said, okay, people can travel, but where will they stay? So she's saying that some places, some hotels can open when it's proof that what the people they're housing are there for business or essential services as well. Of course, tobacco sale is still not allowed, but every other business, more people, the retails, people can now go for drive-through to pick up their food that they order. They still cannot sit at the restaurants to eat. They can order. Before, you were only allowed to for delivery of whatever it is you order. Now you can go over there to pick up whatever it is you want to buy for food. The grocery stores are still open. More people are allowed to go to work. But those other businesses that are affected are still home. But they're still insisting on the COVID-19 precautionary protocols, social distancing and the like, sanitizing your hands and just keeping clean.
All right. Speaking of restrictions, Betty, what more can you tell us about, the delay in the reopening of schools? It was supposed to be today, but now it's been pushed back till the 8th.
Well, many people had been arguing that it's still not safe, it's too soon, even some teachers. So now the minister has been consulting with the different school governing bodies, the parents associations, the teaching associations as well, who have been kicking against it, that they need to be sure or assure the people that they're prepared enough to provide the PPEs, that's the personal protective equipment, as well as assuring that there's water and sanitation arrangements in place. Now, some schools may be prepared more than others, but they're much fewer than those that are not prepared. So pressure was put on the department that, look, if you're including the human rights, the National Human Rights Commission, saying, why don't you delay this a bit to have more schools ready, so that you'll be able to accommodate and ensure the safety of the people. We had parents today in some schools in Cape Town saying, we need to keep our children safe. You don't have to open schools at this time. But then remember, those who do not wish their children to be in school, physical school, can actually opt for homeschooling. But that's a process, and it's not cheap. So these are some of the things that that's causing. But It's been moved to the 8th of June for grades 7 and 12 to resume. That's where we are. They're still trying to smoothen out everything and ensure that the supplies are there. And they're still having to deal with the issue of vandalism as well in some places. So these are some of the things holding back a number of things. But people are insisting safety first before children get to school. And they have to work out what to do with the school calendar, because South Africa's school calendar is January to December and not September to September or July like many other countries, most other countries. So they have to, this June will be one term gone. So they have to decide what to do for those who are now allowed to come back to school or by the 8th of June and those who are still at home. So it's a huge job that the Department for Basic Education is having to deal with.
All right, then, Betty Dibia, our South Africa Bureau Chief, thanks for speaking to us.
Thank you very much.
Well, it's a different story in Tunisia as the schools have reopened across the country as part of plans, of easing the lockdown restrictions. The Education Ministry, in coordination with the Ministry of Health, is also performing rapid tests on students who are either leaving the state or have just returned from another state for COVID-19.
A number of schools in Tunisia have reopened their doors to students under strict health rules as part of a plan to ease lockdown measures and resume daily life while limiting the spread of coronavirus. Strict precautionary measures have been taken in over 600 reopened schools and education centers, including the enforcement of social distancing, face masks, hand sanitizers, and the regular disinfection of school premises.
The precautions that have been taken are based on a health protocol agreed upon by experts in the Ministry of Health. It is a strict health procedure guide related to social distancing, wearing of masks, hand sanitizing, disinfection of educational institutions, and temperature measurement, as you have seen. And this is strictly applied to all of our educational institutions.
As students leave their homes for the first time, some say they feel nervous and scared.
Personally, I am scared for my family. But it's not like before, when people were going to the beaches. Now going out, you feel like it is over, but still, there is fear.
Another student is worried about his skills after being away from school for such a long time. COVID-19 rapid tests are being done to screen students.
This test is meant to investigate the spread of coronavirus. We did it with high school students who are moving to other states or have just come back from another state. It's a quick test and the result is available in 15 to 20 minutes.
Over the past 2 weeks, Tunisia has been relaxing its general lockdown. The night curfew has been shortened and schools are now back to receiving students. The North African country has so far recorded 1,084 confirmed coronavirus cases and 48 deaths.
Welcome back to the program. Ghana's President Nana Akufo-Addo has announced measures to ease restrictions on public gatherings in the country. Under the new directives, church services and Muslim prayers can take place with 100 congregants at a time and for only 1 hour. Social distancing rules and mandatory wearing of masks must also be enforced. The directives take effect from Friday. The restrictions were imposed 2 months ago to stop the spread of coronavirus. In a televised address, President Akufo-Addo said the decision to ease restrictions on selected public gatherings was based on their risk profile, social and economic impacts, and the country's ability to respond to a major outbreak. Schools will be reopened for final year students only. Well, there is no argument that technology has been playing a great role in helping to curb the spread of the coronavirus pandemic that's ongoing globally. At the Kanyenyan COVID-19 treatment facility, a short distance from Rwanda's capital, Kigali, Akazuba, Ikizere, and Gabo, they all report for duty, but these are no ordinary health care workers. In a bid to minimize contact between patients infected with the coronavirus and doctors and nurses, the country has deployed the 3 robots to carry out simple tasks like taking temperatures and monitoring patients. The sleek white robots with big, bright blue eyes and a rather human appearance were donated by the United Nations Development Programme and are helping frontline workers tackle the coronavirus crisis in the East African nation, which has so far recorded 370 confirmed cases of the disease. By relaying messages to doctors and helping the team assess the effectiveness of their clinical decisions, the robots cut the numbers of bedside visits that doctors have to make.
Let's say before we had them, we would visit between 2 to 3 or 4 times a day per patient. But now at least we now up to 2 times a day. So that tells you how helpful they are and what impact they have made in terms of reducing the number of visits to the patient. They help us to decrease or reduce the risk of transmission. That means from patients to staff. So what they do like 50% of the technical work. They take vitals like temperature. They record messages that give us a feedback in terms of clinical judgments.
We're still in Rwanda that has recorded its first death of COVID-19. This new development has caused the government to reverse its planned easing of coronavirus restrictions on Monday. Travel between provinces, including movement in and out of the capital Kigali, was scheduled to resume after more than 2 months. Motorcycle taxi operators, estimated to number about 50,000, were also set to return to the roads. But in a tweet, the Prime Minister's office announced that further measures will be announced on the 2nd of June because of new cases reported in the western Zuzizi district. So far, out of the 370 reported cases in the country, 256 people have recovered. Well, let's get more on the situation in Rwanda. We have joining us a journalist, Magnus Mazimpaka, in Kigali. Thank you for speaking to us.
You're welcome.
Now, the government's decision to reverse the lockdown, how well is it sitting with the citizens, I assume, who have been, looking forward to continuing their normal lives?
Well, I think it's not resuming a lockdown per se. The lockdown was partially lifted, and a curfew begins around 9 up to 5 in the morning. But the only thing that people are not allowed to do is to use, there was no intercity movement from city to city, and borders closed, no flights, and the usual motorbikes, which are very popular transport in Kigali, were not allowed. So last evening, just a few minutes after the announcement of the Rwanda National Police that intercity travels were going to resume today and motorbikes to resume today, there was a couple of cases that came out from the tests that were conducted during the day and indicated a slight increase of cases, around the 11 cases, and some of those cases, 5 of them came from one of the cities. So there was caution that there could have been contact. So what they did was to hang on a bit and do some more tests and tracing so that they do not now expose the public to infections.
All right, now the government is saying June 2nd, the citizens should await further measures. What do you think these measures will entail?
Well, nobody knows, but we can all speculate. But I think it is likely to be either something to do with transport, something to do with entertainment, because entertainment and hospitality is one are the most hit sectors. So apart from restaurants that work from morning to 8, nightclubs don't work, bars don't work, and even the arrangement is in conformity with the social distancing. So maybe the measures could entail some relaxation or new directives.
All right, let's look at the numbers from Rwanda. It is lower than many other countries in the region. The country has just a little over 100 active cases. What is the government attributing this achievement to?
Well, I think apart from China and maybe a few other countries in Asia, I think Rwanda is the only country on earth, following those few countries, 3 or 5, that imposed one of the toughest lockdown, really tough, like one of the toughest. We're talking about a complete lockdown except for a few essential services like healthcare, security, and other essentials such as, let's say, maybe food. The rest of the country was in a complete lockdown. I'm talking about seeing no single human being walking outside of the house 24 hours for almost 2 months.
All right then, Magnus Mazimpaka, journalist in Rwanda, thank you for speaking to us on Network Africa.
You're welcome.
Well, that's it on the program today. Thank you for watching. I'm Layo Adegoke.